I was diagnosed last May 2014, and my doctor told me that I had about a year to live. I think if I would have taken his advice, I don't know that I would be here today talking to you.
Last year, Ann Glauber was given a death sentence.
We went down to the office, and the doctor sat in front of us and said to us in a rather cold way, "I have devastating news to give you. You have stage 4 pancreatic cancer."
Ann's doctor recommended high-dose chemotherapy, but she didn't want to spend the little time she had left suffering the harsh side effects.
And I turned to my family and I said, "I'm not taking that advice."
Do you think most people would approach a diagnosis the way that you did?
No, I don't. They hear the negative news from their doctors. They don't want to hear anything else. I think the way to approach this disease, as in every kind of diagnosis, to be an activist for yourself and an intelligent consumer.
In general, Americans are intelligent consumers. We comparison shop everything, except when it comes to our health. And when it comes to cancer, which can be emotionally overwhelming, billions of dollars are at stake. $100 billion globally spent on treatment alone last year.
There's an enormous difference when people learn how to become consumers of medical care rather than acceptors of medical care.
Leslie Michelson is chairman and CEO of Private Health Management. He spent the last 30 years helping people get the best medical care from what he calls a broken system. Why? Because nearly a third of the $3 trillion Americans spend on all healthcare is used on what Michelson calls unnecessary tests, treatments, and procedures.
The number one mistake that people make is thinking that anyone who has an MD after their last name is right all the time.
Dr. Peter Scardino is the chief of surgery at Memorial Sloan Kettering Cancer Center in New York, and he's seen firsthand the communication problems that doctors and patients sometimes have.
We see over-treatment, incorrect treatment, and under-treatment all the time working in a cancer center. I think the ideal doctor-patient relationship involves open communication. So I like patients who are engaged, who are inquisitive, who are questioning, and who really don't necessarily take everything I say as gospel.
And Michelson says that attitude is key to getting the same level of healthcare as the 1%, no matter the diagnosis. That's the focus of his new book, The Patient's Playbook.
I've handled healthcare issues for some extraordinarily wealthy people, and the truth is, they don't get much better healthcare than everybody else. The people that get the very best medical care, who ask questions, who coordinate, and make the best decisions.
But is that really all it takes to get the best medical care? After all, not all insurance plans will pay for a second opinion. Are you in a better position to be an activist if you have money or education?
I think having resources definitely helps to be an activist, but I do think anyone can do it.
Whether or not everyone can do it, Ann did. She found a doctor she was comfortable with, who prescribed lower dose chemo with manageable side effects. And while the journey is not over, today, more than a year later, Ann has already beat the odds of that first dire prognosis.
I think if I would have gone to that first doctor who was going to provide me standard line treatment, I don't know that I'd be sitting with you right now.